Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with Baycare's Winter Haven Hospital to give you, the community, an opportunity to learn more about your local physicians, as well as the important programs and services Winter Haven Hospital provides to keep our community healthy and thriving. On this episode, I have the pleasure of speaking to Dr. Rodrigo Bolanos, the director of the Electrophysiology Lab at Winter Haven Hospital. Dr. Bolanos is board certified in cardiology and cardiovascular electrophysiology. We speak about the signs, symptoms, and treatments of electrical issues with the heart. Well, thank you so much for coming on the show today.
Thank you.
So we always like to start this to give the community an opportunity to learn a little bit more about you personally. So I'm going to ask a little bit about your journey to becoming a physician. What got you interested in medicine?
My father was a physician, so he was an ear, nose, and throat surgeon. But I was the only one of my 6 siblings who actually followed him in his steps. But I'm glad I did.
Well, good.
He was my inspiration.
And did you always have an interest in, cardiology and the heart and things of that nature, or did you take an interest in other things along your path?
So interestingly, I was actually going to follow in his steps directly. I was going to become an ear, nose, and throat surgeon, but at the end, I decided that it was a pretty narrow field of care, and I wasn't 100% sure if I wanted to do it. So I went the internal medicine route, through which one can get exposed to other fields such as oncology, gastroenterology, of course, cardiology. And it was once I got exposed to cardiology that I specifically became interested in electrophysiology, which is a subspecialty of cardiology.
Mm-hmm. And where did you grow up?
I grew up in South Florida, but I was actually born in Central America, in Nicaragua. But my family and I immigrated here when I was quite young. I was only 7, and my father was Nicaraguan, my mother was American.
Very good. And how about school? Where did you end up getting your medical degree, and how did you kind of make your way into electrophysiology?
Right. So it's kind of a long path. I did my medical school at the University of Miami. And then I did my internal medicine training at Cornell Medical Center in New York. And then I was at the University of North Carolina in Chapel Hill for cardiology training. And then I went to Virginia, VCU Medical Center in Richmond to do my electrophysiology training. So medical school is 4 years. And then to get to where I am now, it was an additional 8 years of training.
Wow. So dedicated. You really wanted to go that route.
Yeah, unfortunately, you got to do what you got to do. And so, it's an additional 2 years. It's a very unique field. Mm-hmm. And it's not something that you can just spend a few months following somebody around and then picking it up. Mm-hmm. And in fact, I'm still learning today.
So let's talk a little bit about your field of medicine. What all goes into that? What are you studying, and what are the things that you are trying to treat?
Right. So at its simplest, electrophysiology is basically the study of the heart's rhythms, electrical rhythms. So whether it be the ability of the heart to keep an appropriate heart rate. So we deal with both slow and fast rhythm problems, but it's basically the study of the heart's electrical system. Mm-hmm.
And correct me if I'm wrong, but I feel like Winter Haven Hospital has really made some investments in this area as a part of their cardiology practice. Why is that important to the Polk County community?
Because rhythm problems are one of the major cardiovascular issues that affect our population and population in general, not only here in the United States, but globally. It's one of the most common rhythm abnormalities, for example, is atrial fibrillation. And the incidence is going up tremendously as our population, gets older. So our ability to treat these rhythm problems locally is very important. And so I actually started the electrophysiology program here in 2014. There was no program prior to my arrival. And we have continued to grow it to where we have now 2 electrophysiologists. I brought in an individual, Dr. Acevedo, who has been a great asset. And so now we have 2 electrophysiologists to provide the care that is needed in the community.
So many people are familiar, obviously, with a cardiologist, and so they, may have started at their primary care doctor complaining of certain issues, and then their primary care doctor has referred them to a cardiologist potentially. What symptoms or diagnosis would normally lead them to you?
If you have anything from syncope, meaning passing out, to sensation of your heart racing or skipping, a weakening of the heart, any family history of what we call sudden cardiac death, meaning people just dropping suddenly without an explanation. All those things are medical problems within the cardiology realm that we specifically deal with. Many times we are referred patients by the cardiologist, but one does not necessarily need to go through the cardiology sort of route to get to us. In fact, my partner and I specifically focus on electrophysiology, but we are cardiologists by training. We don't do the testing and the things that the cardiologists do. So we will obviously refer the patients to a cardiologist to deal with some of these other issues. We really just focus on the electrical problems, but certainly you do not have to go through a cardiologist to be seen by one of us.
Are the electrical problems that you may have in your heart, is that normally a solo issue, or is that something that's tied to other issues that a patient might be having?
They can be solo, they can be genetically inherited, they can exist by themselves, but also often coexist with other cardiovascular diseases, such as coronary artery disease, valvular problems, of course, history of what we call cardiomyopathy, a weakening of the heart. And certainly if patients have other comorbidities such as diabetes, high blood pressure, those can also contribute to the development of electrical problems of the heart. But many can occur just by themselves.
Is your average patient age, does it tend to be on the older side, or can people in their 20s develop these issues?
People can be in utero and have these problems. Generally the population that I deal with here is more a Medicare population, just because we have a higher number of those patients. And one of the most common rhythm abnormalities that we spend our time treating is atrial fibrillation and everything that it's associated with. And that tends to become more common as patients get older. But I have treated patients with atrial fibrillation who have been in their 20s. And certainly other rhythm abnormalities manifest much earlier in life, in their single digit years, teenage years, 20s, 30s. So it really depends what the condition is.
If a patient comes to see you, whether you're their first stop after their primary care or they've gone through additional testing from a cardiologist, what can they typically expect a visit or a diagnostic path to be?
Right. So typically the questions are going to be a little bit more in depth than you're probably going to get from the cardiologist. Not always so, but perhaps a little bit more detailed family history. And the focus is going to be on trying to connect the symptoms with which you present, sort of what I say, connecting the dots to a potential rhythm abnormality. And that often requires more extensive monitoring of the heart rhythm. And depending on the situation at that point, then we'll probably move forward to the things that we provide that we train for, which is invasive testing of the electrical system, and many times at the same time a curative procedure to fix the electrical problem, whether that's a device because your heart beats too slow and you need a pacemaker or a defibrillator or something of the like, or you need what's called an ablation, which is where we actually target the abnormal heart rhythms after we've done an electrical map of the heart, cauterize the abnormal focus to fix and cure that problem.
Are those the primary two treatment options that you prescribe in your office in terms of a pacemaker or ablation, or are there other ways that you treat some of the most common?
Right. No, absolutely not. That's just general, that's device therapy and what we call ablation therapy. But some of these things can be treated with medications. The first thing we do obviously is review what you're on, make sure that we're targeting the appropriate condition. We'll do a pretty thorough history. It's a very different experience for sure.
So as someone that considers himself pretty healthy, is there anything that we can do to try to prevent these type of cardiovascular issues? I know you said some of it's hereditary, so some of it you may not be able to prevent, but you can help to mitigate. But what is the best advice you can give someone to keeping that healthy heart?
Right. The same things that that are important to follow to keep a healthy heart from other non-electrical standpoint. So exercising, obesity is a big problem that contributes to some of the electrical problems. Making sure that if you have other coexisting conditions such as diabetes and high blood pressure, that you have those well controlled. There's no such thing as a little bit of diabetes. There's no such thing as a little bit of high blood pressure. So if you need a second opinion to make sure that that's well managed, then you should seek it. And knowing your family history is very important, and staying away from cigarettes. So those kind of basic things.
Mm. Well, and it's funny, I was saying to the last physician that I talked to, whenever I ask that question, it's the same list, no matter what practice area they are in. It's about maintaining that healthy lifestyle as much as possible, exercise, appropriate weight, keeping an eye on, your BMI and things of that nature to really try to maintain the best lifestyle that you can. It really hits every single system that within our bodies. So, well, Dr. Bolanos, thank you so much for coming on the show today. Is there anything else that you want the general public to know about you or your practice?
Know that we're here for you all, and don't hesitate to always get a second opinion, whether you need to seek that second opinion from myself, or if you see me and want a third opinion. I always encourage that. I feel confident that we provide ethical, state-of-the-art care here, and that's pretty much it. I really enjoy what I do, and I'm glad that I came to Winter Haven. Hopefully I'll retire here.
Well, we're glad you did too. And we would love for you to retire here as well. Again, thank you so much for coming on the show. I really appreciate it.
Thank you so much. Have a good day.